going with my first side port. This is a case of NS1 cataract with thick PACC, and such cases usually we do flip and chop technique, because as the nucleus is very immature, such cases usually we go for we don't get a proper grip to have a chopping. That's the reason the best technique for this type of cataract is flip and chop. So I proceeded with my main port. Now here is the trypan blue dye to stain the anterior capsule. Holland Tuni Mausi. So now I'm injecting out the washing out the trypan blue. Now injecting viscoelastic substance. Now we'll do a rhexis. In such cases the rhexis is a bit tricky, because when the nucleus is very soft, the chances of rhexis extension to the periphery is more. So we have to be very gentle while doing the rhexis. We should not do too large rhexis, and should not put too much of shearing force over the rhexis, because it might go for peripheral extension. Because when the nucleus is soft, we don't get a base to pull the rhexis with a firm grip. At the same time, having said that, we should not do too small rhexis as well. Sujata lens nahi hai. Now I'm doing hydrodissection. Such cases, hydrodissection, and we can do a delineation as well, which I don't usually prefer. But if the nucleus doesn't come out properly, then we can go for a delineation as well. Now you can see the nucleus popped out with just hydro from the capsular bag. We'll just try to bring it out to the center and then proceed with our flip and chop technique. Just trying to bring the nucleus US1 వచ్చి দেখতনা with the side port. I'll just make the nucleus stand properly with a good, to make it a proper flip. Yes, now you can see. Now this is an old sleeve, so what is happening, it has become little more laxed. That's the reason while entering into the while entering through the main port, it is becoming little shaggy. We need to high time to change the sleeve. So you see how nicely I did the first chopping, because this is flip and chop. First this chopping we did. Now each heminucleus I'll divide it into further smaller pieces, but never ever do any maneuver towards the endothelium. Always see, after doing the first chop, I pushed the pieces into the capsular bag, then proceeded with my further chopping. So never do any chopping or anything in anterior chamber. Always do in the capsular bag. So you can see the nuclear pieces are in the capsular bag. I'm just making them tilted and emulsifying. The nucleus is very soft. That's the reason, even if the nucleus is chopped, I really don't recommend to do any maneuver, let it be chopping or emulsification in the anterior chamber. So after doing the first chopping, when I made the nucleus divide into two heminucleuses, I pushed them into the capsular bag, and then I proceeded with my further chopping and emulsification. So the last piece is there. So a little bit of cortex I'm trying to remove with the phaco tip only. How much I can. Let's see. Usually the sub-incisional cortex is, rest part of the cortex is nicely removed, but sub-incisional cortex is there. that is not getting dragged with the phaco tip, and we should not try for much time also, because the subincisional cortex, see, removing the cortex with the phaco tip is not a very bad technique, because it is nothing but coaxial instead of bimanual. But if it is not getting removed, then we have to proceed with the bimanual irrigation and aspiration. So in flip and chop technique, whenever we are chopping the nucleus, make it to divide it into two fast smaller fragments, then each heminucleus, push them into the capsular bag, and then proceed with the further emulsification. Now the subincisional cortex I'm trying to remove. See, only little bit of cortex was there. I removed it by the bimanual irrigation and aspiration. Now we'll inject the lens. The air came and it might interfere with my IOL injection. I'm just trying to remove that out. It nicely went into the capsular bag. So whenever the lens is loaded properly, it nicely slips into the capsular bag, so no need for us to rotate it more and more with the dialer. So whenever we are doing the flip and chop technique, make sure none of the maneuver, even if you flip the nucleus, just break it into two heminucleuses, but then make sure you push them into the capsular bag and then proceed with the further. Patient is little bit squeezing the eye. I'll give a little bit of subconjunctival injection. This completes our phacoemulsification cataract surgery under topical anesthesia in case of a immature cataract. So such cases, when you are doing a flip and chop technique, in case of immature cataract, when you flip it, make sure after doing the nucleus into two heminucleuses, push the heminucleuses into the capsular bag, then proceed with the further technique.